Okay, so a short video, my 7 principles of excellent physiotherapy, just simple things, principles that you can employ in your sessions that's going to hopefully make you more successful and your patients to like you more. So the first thing is, number 1, movement is always the problem. Now, what I mean by this is obviously some people come in and they've got pain in certain areas or they've got a lack of function, they can't do a certain activity. But movement is always the problem. There's either too little movement because you've got stiffness in a particular area, or there might be too much movement for people who are hypermobile, lots and lots of uncontrolled movement, say in limbs, which is causing stresses that needs to be strengthened, or what I would loosely term faulty movement. And that is where, for that particular individual, a certain movement is causing a problem. And the obvious example for this sort of type of thing is a shoulder, because the mechanics of the shoulder are the most complex really in the body, with the shoulder blade, the connection to the collarbone, the connection to the neck, and the ball and socket of the shoulder. And so the coordination that's required for all those multiple muscular connections is quite complex in terms of what needs to happen. So it's very easy for certain structures to get overactive or tight or weak, or probably a combination of those things. And that means that we get a faulty movement. Essentially, maybe that scapula is not moving up as it should do. Maybe that ball and socket has not got its glide. Maybe it's not got its spin. Maybe it's not got its rotation. And these are contributing to a onward pattern of pain for the person. So always consider movement is our solution to the problem that somebody is coming in with. Number 2 is always use a test-retest during the session. Now, what I mean by this is that it's possible during a session to do a treatment that makes some kind of difference to that individual, which shows them, one, you know what you're doing, and also is a confirmation to you that actually what the problem is the problem. Now, a good example of this is if we have an individual who has a problem with a neck, they've got pain in their neck, and remember, movement, and this is the right, it's at the top, number 1, movement is always the problem. If you turn your head and they've got pain, they usually have some kind of restriction, unless they're hypermobile, in the neck motion. What you can do then, after you've tested that, you point that out to them. Look, you can only go 3/4 of the way around to the left compared to your right side. And quite often they'll say, oh yeah, I didn't really notice that. All I can feel is pain. But point that out and then do your mobilization, soft tissue work, and stretches, whatever the treatment is, and then retest it. Point out to them you're looking for that improvement, even if it's a few degrees, or ideally it's obviously less painful. But throughout the session, you can retest at least once, but maybe a couple of times, to prove what you are doing is effective. And you can do this for multiple problems around the body. We want the person to come in with the problem. We want to do something within the session that proves to them that we know what we're doing. We retest it, and we always emphasize it. We point it out what the problem was at the beginning of the session, what we have done and why, and then the outcome of it, which is hopefully improvement. Now, you don't always get that improvement that you're looking for. Things aren't as simple as that. But I would say 90% of the time, you do get some kind of positive change, which can reinforce good motivation, trust in you. And I found it a really, really good strategy. Rather than somebody coming in, they've got pain, we do maybe a bit of treatment, we send them off with the exercises, and they don't really know whether they feel any better or not, because they kind of feel still in pain. Maybe they're slightly better, but there's no empirical objective marker that proves it. So use it. Use an empirical, as far as is possible, test-retest during every session. Number 3 is the grade of treatment and the load of exercises is dictated by the estimated tissue state and pain. So how is our tensile strength of tissue? What is the stage of the injury at, if it is indeed an injury that's causing the problem? Or what is the pain level? Are we in severe high levels of pain, in which case we may drop down to a lesser grade and lesser load in terms of exercises? What is the tissue state and what is the pain? And let that dictate how hard we're going to push things, the load that we're going to put down in terms of exercises. And if we get that right, then every chance we're going to get some positive adaptation and be able to progress on. Number 4, we try to get a quick win in the first session. And this goes back to our test-retest, that if we can do something within that session that makes a difference, we emphasize that heavily as well in terms of what's done. That quick win proves to that person that we know what we're doing, that we're going to help them get better. So always go for something in that first session with somebody when they're not sure about you, they haven't developed any trust relationship with you. Do something that makes them feel better. And that is a really good way of getting people hooked to come and see you again. Number 5 is carefully manage expectations. So going back to circling back round to our quick wins. Some things are not straightforward. Some things are difficult to do. I particularly find shoulders a real pain. Is that if you've got a rotator cuff problem, getting that significant improvement within a first session is quite difficult often if it's a really, really irritated rotator cuff. So what we need to do is we need to manage those patient expectations through education about the problem. Listen, you've got a tendon problem. Tendons have got really poor blood supplies. They don't heal as well as muscles, and therefore they take a little bit longer. So we need to be a bit patient, but if we stick with the process, then we're going to be able to move forward. And even those slight improvements in range or slightly reductions in pain, those are significant in terms of shoulder problems. I'm managing the patient expectations. They're not expecting me to do something to feel amazing afterwards and and if it happens, brilliant. But if I've managed their expectations regarding the problem, then we're on the same page and they're more likely to be a loyal customer to me. If I haven't managed those expectations, their expectations of improvement are too high, then therefore we are going to have a problem because they're not then going to value what we've done. And number 6, less is more. And this is often the case, that actually in terms of exercise prescription, I find that maybe 2 or 3 exercises focused on a particular issue, maybe not all of the issue, it might just be mobility in the first issue, in the first instance, it might just be mobility, or it might be just the strengthening element. But 2 or 3 exercises are adhered to more by the patient. They understand them better, especially if we are telling them why they are doing those 2 or 3 exercises. And they're not just a throwaway at the end of the session where we say, I'll send you a sheet of exercises. There's going to be like 5 or 6 on them to do. And it's a scattergun approach rather than if we've got 2 or 3 and we're saying we want these exercises to improve our range of movement from this to this. And then when I see you next week, we'll be looking for that to take place. Then they are on board for why they are doing it. It's human behavior as well, in terms of if we got a million exercises to do in front of us, we're less likely to do them than we are if we've got only 2 or 3 to focus on. So I try to make it as easy as possible for people to adhere to exercises, because human nature is difficult to overcome habits and to form habits as well. And this works. If there's too many, I've seen over the years, then unless they're real keen exercises, then they don't tend to do them. Number 7, to wrap it all up into one nice package, is people are happy to pay if they value what you do. So if from all of these other factors, we've done our job, we've emphasized movements being a problem, we've tested, retested, we have emphasized during the sessions that we've made a difference, We have graded their treatment and their exercises appropriately for their particular form of recovery. We've got our quick win in our first session with that person. We've managed those expectations. We've given them 2 or 3 exercises which are focused on what they're doing. If they value what we do, that we have made a difference with them and that we are experts and they can see that, then they are happy to pay because they're going to get a result. And that is the most important thing with people, is to actually get a result. So there we go, 7 principles of excellent physiotherapy. Give them a go and you see if it doesn't work.